While the brain is our most complex organ, its main objective is simple: to keep us alive and achieve our goals. It does this by helping us breathe, eat, walk and talk, the basic essentials to our survival. It is geared to search for any dangers in our environment and primes us to respond quickly. What's more, our brain gives us the ability to plan ahead, solve problems, experience emotions, store memories, and communicate with others, all the things that make us human. Our brain is the control centre of our entire body, driving our every thought, feeling, and action. Just how do our brains do this? There are three main regions within the brain that serve a specific function as we interact with our environment. At the base of our brain is the primitive region, in the middle the feeling region, and at the front and top of our brain is the thinking region. While these three regions have their own special function, they operate as one connected network to keep us alive and reach our goals. The primitive region of our brain looks after those basic life functions that just happen automatically, like our breathing and heart rate. It also helps coordinate our basic physical movements, such as our balance and posture. More than this, it plays a key role in scanning our environment to search for those things that may threaten our chances of survival. This helps the instinctual part of our brain kick into action automatically. The middle feeling region of our brain plays a significant part in our emotional and social experiences through life. This is the part of our brain where emotions and impulses, such as anger, fear, and pleasure come from. It is activated when our primitive region detects a threat in the environment and triggers our fight or flight response. This region drives many of our behaviours and habits and helps us form memories and attach feelings to them, particularly when we experience strong feelings, such as fear or happiness. Lastly, the thinking region is the largest and most highly developed part of the human brain. It stores our memories, allows us to plan, enables us to imagine or analyse a situation, find a solution, and communicate with others. It is the part of the brain where we can take control of decision-making and emotion and override our automatic responses from our primitive and feeling regions. Our thinking region gives us our likes, dislikes, hopes and ambitions, those things that make us uniquely human and different to all other animals on this planet. These three regions of the brain work together to coordinate our every thought, feeling and action.
Neurological examination is an assessment of sensory neuron and motor responses, especially reflexes, to determine whether the nervous system is impaired.
Good morning, ma'am. My name is Benico. I'm going to be your student nurse for today. May I know your name, please?
Libed.
Today, ma'am, I'm going to perform a neurological assessment. It contains 7 categories. First is to test your mental status, cranial nerves, motor system, reflexes, sensory system, coordination, and lastly is your station and gait.
We have 7 components of mental status exam: level of consciousness, attention, orientation, language, memory, higher intellectual function, mood, and affect.
Ms. Libed, how old are you?
32,
32, and where do you live?
Talavera na Paisina.
Talavera. When is your birthday, ma'am?
September 28, 1982.
Do you know where we are?
Yes. Rural Health Unit of San Ricardo, Talavera.
And what's the date today?
December 15, 2014.
Okay, ma'am, thank you.
The 12 cranial nerves are olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, spinal accessory, and lastly, hypoglossal. Olfactory nerve. It is the first cranial nerve. It carries the sensory information for the sense of smell. It cannot evaluate if nasal passages are obstructed by rhinitis, polyps, and etc. It should be eyes closed. Occlude one nostril and test other than compare. Use non-irritating substances such as peppermint, menthol, and ammonia.
Mom, can you please close your eyes? Can you tell me what this is?
Coffee.
You can now open your eyes, ma'am.
Optic nerve, the papillary function. Normal pupils are equal in size and shape and are situated in the center of iris. Papillary size varies with intensity is equal to 3 to 4 millimeters, and meiosis is equal to 2 millimeters, and myidiasis is equal to 5 millimeters, and lastly, aniscoria is equal to papillary asymmetry. Cranial nerve 2 and 3, light reflex. Shine bright light obliquely into each pupil. Look for both direct same eye and consensual opposite eye reaction. Record the pupil size and shape.
Now, mom, please look at me.
Cranial nerve 2, 3, 4. Accommodation. Hold one finger 10 millimeters from patient's nose. Alternate looking into distance and add finger. Observe papillary response.
And now, mom, can you please look at my finger?
Cranial 5 and 7. Ask the patient to close their eyes so that they receive no visual cues. Use a sharp implement. Touch the sharp tip of the stick to the right and left side of the forehead, assessing the ophthalmic branch. Touch the tip to the right and left side of the cheek area, assessing the maxillary branch. Touch the tip to the right and left side of the jaw area, assessing the mandibular branch. Place your hand on both temporalis muscles located on the lateral aspect of the forehead. Ask the patient to tightly close their jaw, causing the muscles beneath your fingers to become taut. Then place your hands on the both masseter muscles located just in front of the temporomandibular joints.
And now, mom, can you please close your eyes again? And now tell me if the thing that I'm going to stroke your face is either soft or sharp.
Okay. Sharp. Soft.
Now, ma'am, I'm going to assess your jaw strength. So, can you please show me your teeth? Thank you, ma'am. For our next procedure, ma'am, can you please put your right hand on the top of your head? Then, crease your forehead, ma'am. Okay, good. Now, you can put down your hand now. And next is, can you please put air inside your mouth while it's closed? Okay. Then, next is, can you please smile, ma'am? Okay, very good, ma'am.
Acoustic nerve, the 8th cranial nerve, concerned with hearing, balance, head position. It branches into two parts, a cochlear part that transmits sound reception for hearing, and a vestibular part that sends balance and head position. Weber's test. Determine whether an issue is conductive or sensory neural hearing loss. Conductive hearing loss occurs when sound waves are not able to pass through the inner ear. Sensory neural hearing loss occurs when auditory nerves or hair cells are damaged in the inner ear.
And now, ma'am, we will perform the Weber's test. I will put this tuning fork above your head and you will feel some vibration. And you should tell me when the vibration stops.
Okay. It's gone.
Okay.
Ryan's test compares air and bone conduction hearing. Air conduction hearing occurs through air near the ear, and bone conduction hearing occurs through vibrations.
After the Weber's test, we will perform now the Ryan's test. I will put the tuning fork behind your ear, and you will also feel vibration, and you should tell me again if the vibration stopped. And after that is I will place it near your ear, and then you can hear some sounds, and you should tell me if the sound is gone. Okay.
Glossopharyngeal and vagus nerve. Glossopharyngeal nerve is responsible for swallowing and gagging. Vagus nerve is to relay signals between brain and various body systems to regulate heart rate, speech, sweating, blood pressure, digestion, glucose reduction, and certain aspects of breathing.
Okay, ma'am. Now for our next procedure, we will assess your glossopharyngeal and vagus nerve. We will use this tongue depressor and check for your voice, swallowing, and gagging reflex. Okay? Sure. Now, ma'am, open your mouth. Okay, ma'am. Now say, Now, ma'am, can you please try to swallow? Okay, ma'am, very good. Thank you.
Spinal accessory nerve, responsible for tilting and rotating the head, elevating the shoulders, and adducting the scapula.
Okay, ma'am. In order for us to assess your spinal accessory nerve, we should proceed to the next procedure. Now, I will place my hand to the side of your face, then try to resist the force that I will apply to it. Now, to the next. Now, can you please shrug your shoulder, the right shoulder, now the left, both shoulder. Okay. And lastly, ma'am, I will place my hand below your chin. Now, try to rotate your head to the left. Okay, ma'am, now to the right. Okay.
Hypoglossal nerve, responsible for innervating the muscles of the tongue and articulation of speech and the act of swallowing. Have the patient push the tongue into each cheek.
And for the additional test, ma'am, can you please push the inside of your cheeks using your tongue to the right and now to the left. Okay, ma'am.
Reflexes is a simple nerve circuit. A stimulus such as light top with a rubber hammer causes sensory neurons to send signals to the spinal cord. The signals are conveyed both to the brain and to nerves that control muscles affected by the stimulus.
Another category of neurological assessment, ma'am, is reflexes, and now we will assess your reflex. So can you please turn over, ma'am, and put your right knee to the bed so I can see your Achilles tendon. Okay. Okay, ma'am. That's your plantar reflex using this.
Motor system includes the brain and spinal cord motor pathways and all motor nerves and muscles throughout the body. Abnormalities in the motor system can be detected by assessing muscle strength and tone.
Another category of neurological assessment, ma'am, is about motor system. Now, ma'am, can you please raise both your hands? Then, I will apply some force into each arm and you should resist it. Now, ma'am, close your eyes and then count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. You can open your eyes now. I will apply some force into your wrist and you should resist it again. Okay. Next one. Okay. Now, ma'am, can you please harden each finger in your hand? please put your thumb and pinky together? Next one. Okay, thank you. Ma'am, you should lay down. Now, ma'am, I will apply some force into your knee, and you should try your best to pull them together. Now, ma'am. Okay. Now, ma'am, I'm going to use some force again to your knee, and you should now try your best to pull away your both knees. Okay, thank you. Now, ma'am, imagine that you're driving, and now your foot, press the gas pedal as hard as possible. Now the other foot, ma'am. Okay. Now I will give some force again into your toes, and you should resist it. The other one.
Sensory system. It includes testing for pain sensation, light touch sensation, position sense, stereognosia, and gravitation. Stereognosia, asking the patient to close their eyes and identify the object you place in their hand. Astereognosis refers to inability to recognize objects placed in the hand. Gravitation, asking the patient to close their eyes and identify the number or letter you will write with the back of the pen on their palm. Apraxis are problems with executing movements despite intact strength, coordination, position sense, and comprehension.
Sensory system is one of the categories in neurological assessment. Now, ma'am, I'm going to touch your leg with this cotton buds with a soft and sharp part. Now, you're going to tell me what part is touching your skin. Now, can you please close your eyes again, ma'am? Tell me if the part that's touching you is either soft or sharp, okay?
Okay. Sharp.
Okay.
Soft.
Now,
Sharp. Sharp.
okay. Now, ma'am, I'm going to write in your hand, and you should tell me what I am writing.
Number 0.
Okay, ma'am. Now, on the other hand.
Number 8.
Okay. Now, I'm going to put something in your hand, and you should tell me what thing is in your hand, okay?
A coin.
Okay, ma'am.
A wristwatch.
Very good, ma'am. You can open your eyes now. Thank you. Now, ma'am, we're done in the sensory system. Can you please stand up now? Or you can just sit in your bed. Okay. Now is another category is the coordination, station, and gait. Now, ma'am, repeat after me. Tap your fingers using your distal thumb like this. Okay, do it on your own. Thank you. Now, tap my hand using the ball of your feet. Okay, ma'am? Okay. Thank you, ma'am.
Romberg's test. Ability to maintain an upright position with feet together and eyes closed. Sway or fall when eyes closed indicates impaired proprioception or vestibular function.
Now, ma'am, we will perform the Romberg test. Now, please stand up. Okay. Now, ma'am, put your both feet together and close your eyes. And then count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, ma'am, you can open your eyes now. Now, ma'am, can you please stand up? Remove your slippers, please. Then, with me. Now, ma'am, walk into a straight line. Turn around. And then walk from heel to toe into a straight line. Now, turn around again. And then, now use your heel when walking. Turn around. Then, this time, use your toes. Okay, turn around. And then, hop using each foot. Then, the other. Okay, now, do a shallow knee bend.